Good morning, greeting friends, colleagues, and fellow freedom fighters. I want to start by saying I wish I was there with you. I wish I could look into your eyes, feel the warmth of our shared presence, and take up space together unapologetically and powerfully. But today I'm speaking to you through a screen because a border said no. A visa was denied. A system decided I didn't belong, not because of who I am, but because of where I'm from. It is painful, not just personally, but politically, because when intersex people, especially those from the global south, are denied entry, it's not just our bodies that are kept out, our truth, our perspectives, our right to shape the global conversation are also left at the border. And now I also speak to you with a heavy heart, but also with fire. Let this moment remind us why we do this work. Let it remind us that visibility without mobility is not justice, and that inclusion without access is not liberation. I'm not here just as a professional today, but as a person committed to social justice who also happens to be intersex. And as I speak today on the psychological and cultural differences in intersex well-being and policies, I ask that we hold space not only for data and for definitions, but for stories, silence, struggle, and truth that intersex people have to navigate daily. Allow me to start with the notable words of Audre Lorde, who said, "There is no such thing as a single issue struggle because we do not live single issue lives." This truth lies at the heart of intersex well-being. For many intersex people like me, our well-being is profoundly impacted by early and often traumatic experiences of medicalization. I wasn't an infant. I was already a young person when I faced medical harm, at an age where I was beginning to understand myself and the world around me. My body was treated as a problem to be corrected. My mother, like so many caregivers, was misinformed and pressured by medical professionals into consenting to a surgery I did not need. One that wasn't about saving a life, but about forcing my body into the narrow definitions of normal. It was presented as care, as necessary, but it was neither. The decision was made without my full understanding, without real choice, and certainly without my consent. What was taken from me in that moment was more than physical. It was the right to grow into myself on my own terms. This is not just my story, it's part of a broader global pattern. Multiple reports by the Office of the United Nations High Commissioner for Human Rights condemned these non-consensual surgeries and identified them as a human rights violation. Intersex infants and children continue to face irreversible and unnecessary medical procedures in at least 35 countries, including the global north and south alike. Despite calls for prohibition from human rights bodies such as the UN Committee on the Rights of the Child and the Committee Against Torture. The unanswered question always is, what is being normalized and who benefits from this normalization? And trust me, it's not for the intersex person who hasn't given consent. Our psychosocial harm as intersex people doesn't begin in the body. It begins in the ideology that there are only one acceptable way of what a person should look like. These mental health challenges in intersex communities are well documented. According to a 2017 study by the Australian Human Rights Commission, intersex individuals report high levels of anxiety, up to 60%, depression, up to 52%, and suicidal ideation, up to 19%. Numbers significantly higher than the general population. But I would like to add that these are not inevitable outcomes of being intersex. They are responses to rejection, erasure, shame, and silence. Let me put this clearly. Pathologizing intersex people is not healthcare. It is structural violence, and it is reinforced by cultures and policies that prioritize conformity over care and well-being. Our cultures shape how intersex people are seen or unseen. In many African, Caribbean, and diasporic contexts, intersex births are shrouded in myth, stigma, or spiritual interpretation. Families are forced to choose between secrecy and exile, between hiding a child and losing a community. In some communities, intersex bodies are seen as omens or curses. In others, they are spiritual beings, revered and feared, and in others, they are simply ignored. For example, in recent research in South Africa and in Zimbabwe, children born with variations in their sex characteristics are sometimes subjected to harmful rituals, abandonment, or even trigger warning, infanticide. These acts are not solely about belief, they are about the deeply embedded colonial, religious, and patriarchal fears of bodily differences. We need to be cognizant that culture is not static and therefore evolves. As the late Dr. Maya Angelou once said, do the best you can until you know better. Then, when you know better, do better. We know better now, so how do we change the story? We need cultural interventions, storytelling, arts, faith engagements that can hold the complexity of intersex existence. We must decolonize the very idea of normal and uplift Indigenous, African, and Global South knowledge systems that celebrate fluidity and diversity. Policies can be liberating, but they can also be tools of harm. Public policy is often envisioned as a mechanism for protection and equality, yet for intersex individuals, policy has historically functioned as a double-edged sword, capable of both liberation and harm. In many parts of the world, intersex people remain subject to non-consensual, irreversible medical interventions. These procedures are frequently performed in infancy or in early childhood, despite the absence of medical necessity, violating the right to bodily integrity and informed consent. As the ILGA World's Intersex Legal Mapping Report of 2023 points out to us, that there's still a widespread of lack of legal protections for intersex people. Most countries do not have laws specifically protecting intersex people rights, and legal frameworks largely ignore bodily autonomy and informed consent for children. Intersex people still face unnecessary surgeries, and this is still seems to be legal in many countries. We've only seen a few countries over the years have partial bans or restrictions like Malta, Greece, and Iceland, but still many countries do not protect or promote the rights of intersex people. Intersex people also have very little to none anti-discriminatory protections, as we see that very few countries explicitly prohibits discrimination based on sex characteristics. Intersex people do not have access to legal gender recognition, and in some countries they are forced sterilization or surgery for legal recognition. So you have to conform to a certain sex or a certain gender to obtain the legal gender recognition. You cannot just exist in your body as an intersex people. Intersex people still have a lack to justice and redress. Intersex people can often not seek accountability for the human rights violations that they face. The legal system generally fails to recognize intersex people or even intersex genital mutilation as a form of violence or torture. These are steps forward, but enforcement and meaningful change remains inconsistent. Global and regional efforts are also gaining momentum. In March 2023, we saw the African Commission on Human and People's Rights adopt Resolution 552. This is the first continental legal instrument for intersex people. It calls for ending of non-consensual genital procedures, prohibits discrimination, and demands recognition. Yes, the resolution had a lot of flaws in terms of language, and the description of what an intersex person should be. But for the first time in Africa, intersex people were recognized. And the African Commission of Human and People's Rights adopted this resolution to affirm that intersex people exist in Africa and therefore they need to be protected. In April 2024, the UN Human Rights Council adopted Resolution 5514, its first resolution on intersex rights, urging states to protect intersex people from violence and harmful practices, with a global report expected in 2025. Even well-meaning policies often erase intersex people, and even under the broader LGBTQI+ umbrella. Intersex people are not just an I in an acronym. We have distinct realities that require intentional focus. Intersex people need policies that is centered around intersex people. We need to prohibit unnecessary medical interventions on intersex people. Ensure access to affirmative intersex competent mental health care. Respect self-determination and bodily autonomy. Fund intersex-led research and culture change work. Center intersex voices not as subjects, but as architects, because intersex people are the subject experts about intersex people. As Bell Hooks reminds us, the moment we choose to love, we begin to move forward towards freedom, to act in ways that liberate ourselves and others. Policies for intersex people should be rooted in love and not fear, not control, not erasure, but a foundation of freedom. Intersex people are not just intersex, I think, as the report has just shown previously. I myself am a Black queer intersex woman who grew up in the apartheid state in South Africa. Due to segregation, my family was forced to live in a two-bedroom house with more than 11 people. At the age of 16, I had no thoughts about what is happening with my body. Why do I have to go through the surgery? I didn't think about my wellness. I didn't even think about a hopeful future. At the age of 16, I had to think about how do I work to ensure my family has enough food to eat. So when we talk about intersex people and their well-being, we need to understand intersex people are Black, are brown, disabled, queer, Muslim, poor, rural, and migrants. We are whole human beings. We are not just intersex. And every layer of our identity can either compound vulnerability or amplify resilience. As Kimberly Crenshaw reminds us, intersectionality is not a theory for academics. It's a lens for survival. To advocate for intersex well-being, we must confront racism, colonialism, misogyny, ableism, and poverty. It's to build movements that refuse to leave anyone behind. Intersex liberation is not a fringe issue. It's a test of humanity. When we make space for intersex children to grow without shame, we build societies where all children can thrive. When we create cultures that embrace bodily diversity, we undermine every system that tells us we are not enough. When we pass policies that center the voices of those who are most marginalized, we build democracy from the ground up. I will end by re-echoing Harriet Tubman's words. Every great dream begins with a dreamer. And today I dream of a world where intersex people are free, free to exist, free to speak, free to live with dignity and pride. Let's dream together so we can achieve this world where intersex people are free to just exist as who they are. Thank you.